Hi, I'm Cindy Crosby from birthsmart.com, and today I just wanted to share with you a little bit about the second trait of optimal maternity care, which is women have freedom of movement during labor. And basically that's just what it sounds like. Women would be able to change positions, to walk, to get into a bathtub, to get out of a bathtub, and through this movement and changing positions, she's able to help her baby to rotate and get into the best spot possible. Many times when women are experiencing back pain during labor, if they're able to go into a hands and knees position where they're taking the baby's weight off of their back, it relieves their back pain, it makes them more comfortable. At the same time, it helps their baby to rotate into a more favorable position for birth. So you can learn more about freedom of movement during labor in this book called Active Birth by Janet Velasquez. It's a great resource that I would encourage you guys to check out. And so basically, it sounds like a great idea, and there's so much evidence that it is that is so beneficial to women, but there are some obstacles that make it difficult for most women to achieve that, particularly women who birth in a hospital setting. And those challenges are the electronic fetal monitoring and the IVs that we're constantly hooked up to in a hospital setting. And you do have alternatives. That's typically what is done, but you are able to ask for intermittent monitoring, where a nurse can come in periodically and listen to you, just as they listen to you in your prenatal checkups, and they can look at you face to face and interact with you rather than just watching what's going on in your room on a monitor based on the monitor that's on you. If that's not available due to staffing issues or training issues, you could also opt to have an electronic fetal monitor on maybe 15 minutes out of an hour or something like that. You don't have to be hooked up to an IV during labor, even though it is a common practice. You can choose to eat and drink during labor and hydrate yourself according to your thirst and how your body feels. So you can refuse an IV, and if you aren't comfortable with that in case of an emergency, or if your provider's not, you can opt for a hep lock, where you have a needle in your arm and you're able to be hooked up to an IV if that becomes necessary later on. So you do have a wide range of options to help you get better mobility in your labor. And I think just overcoming the psychological aspect of seeing a bed in the center of a room, it's the focal point, women automatically feel like they need to be on the bed since that's the central feature of the room. So we can just kind of teach ourselves that that's not where we need to be during the labor. So an experience I had that illustrated this principle really well was my second doula birth that I attended. And during that experience, I witnessed a woman who experienced a very long labor. Her baby was in a posterior position and needed to rotate around about 270 degrees before she was able to come out the way that fit best through her mom's pelvis. And the labor was long, but the mother was able to walk and change positions during labor, and eventually that baby did rotate all the way around and came out just as she was supposed to. And I had to contrast that with an experience with a friend who delivered just about the same time, but my friend, her labor was induced and she received an epidural, and because of her immobility, when she faced that same challenge, that same variation of normal, when her baby was also posterior, she wasn't able to help her baby rotate and change positions because of her immobility. And in her case, the doctor ended up putting his hands up, trying to rotate that baby around, and eventually she had a forceps assisted delivery, and it was quite traumatic and difficult for her. And just as I contrasted those experiences, I just saw the advantage of allowing the woman to have freedom of movement during labor, and I was just so impressed at how well our bodies can work to do what they're supposed to. And so I would just encourage you to take advantage as much as you can of the opportunity to have that freedom of movement in labor. And as you follow your own intuition, your body's often telling you ways that you can experience less pain or more comfort as you labor, and those things often correspond with what will help your baby to get into the most favorable position. So I wish you the best of luck for your birth, and have a good good day.